Before we got started, to sort of set the stage is what draws me to psychiatry and what I think was so interesting is really one of the only fields in medicine where we get to look at facts and appreciate facts and research and objective findings with the more intuitive, the introspective, and the subjective part of our experience, and really try to find the intersection of those two areas. And today, what we're going to talk about is really stress as it relates to kind of what's it doing to your body, what's the research, what are the facts behind what's happening here. But I think you'll also find that I'm trying to bring in as well your own personal experience and trying to reinforce to you the importance of staying connected to that as well. So onwards, stress. We know it when we feel it, right? So we have no question. When someone says, I'm feeling really stressed out, we have a sense of what they mean. But what is it exactly? It's actually physiological and psychological pressure that disturbs the body's equilibrium. And I'm going to talk a little bit more about what equilibrium means in a moment. But I want to reinforce here that actually it's a very adaptive response in the short term. So, being stressed out makes sense. There's a reason our body gets that way. And I'm sure you've heard before, in your, at least in your high school biology class, let's say, about the fight or flight response, right? And the idea that it helps us to either confront or remove ourselves from danger. Not only that, there's some research that shows that our learning can be enhanced by optimal levels of challenge or stress in our lives. So stress in and of itself is not a bad thing, but we're going to talk about this idea of equilibrium and how it relates to chronic stress, the kind of stress that most of us are under in a high-pressure world. So equilibrium. So this is the idea that many processes in our body actually have a set point where the body operates optimally. These are core processes like temperature, pH, oxygen, and your carbon dioxide levels. But they're actually also more complex processes like the amount of time you're sleeping, like the timing of your sleep cycle, like the amount and the ratio and the types of foods that you're eating, and the amount and the type of physical activity that you're doing, as well as the quality of your social interactions. And really, one of the hallmarks of our high-pressure work environment is the glorification of stress. And I think most people, when you start to think about it, realize that this is a big part of our day-to-day lives, the idea that, we should expect to be stressed out all the time. And it's really even a badge of honor, right? How little sleep, how many 16-hour days in a row, how many all-nighters I can pull, how many different projects I can do while raising, children with my full-time job, right? And I think regardless of the field you're in, coming from medicine myself, this is very prominent as well. So I think to keep in mind, the mentality behind this is really, if I'm not stressed, I'm not working hard enough. Mm-hmm. And in a high pressure work environment, that set point is even higher, right? The level of stress that I need to be under and the level of stress I should be feeling in order to feel like I'm doing a good job is really high. And the outcome of all of this is what I'm going to call the work bleed, okay? That's the incomplete separation between work and other time in your life. So work sort of takes over everything, whether you're out with your children or you're out trying to have fun with your friends, work is still there, you still have the stress, it's still it's still going on. So, and I want to talk a little bit about what's happening here with the work bleed, right? So we have all this excess work that we're doing, and we are overstimulated as a result of that, and we're also really psychologically amped as a result. These all come together. And what that leads to, when we have excess work, we actually get tired, we're fatigued. When we're overstimulated, our minds are overactive. And then when we're psychologically amped, we actually don't sleep well, we have more anxiety. And all of this combines to make us more emotionally sensitive. And so our social interactions often become more difficult. Along with this, our concentration goes down, our focus goes down, our motivation is impaired. And at the end of the day, we do all this excess work and it really decreases our work performance. And we innately understand this, and so what do? Well, we compensate, and that makes sense, right? What we do is we say, okay, I'm stressed, I need to be stressed for my high pressure job, so, let me drink some caffeine, let me, use some energy drinks because I'm sleep deprived and I'm not really sleeping very well. And then we use alcohol, we use Klonopin or Xanax, or we use Ambien and other sleep medications to try to get us to sleep because we're so amped up. And then, maybe we use some marijuana to slow us down or reconnect with our creativity, and then we use stimulants. And I'm not talking about, when you actually have a diagnosis of ADHD, but really from the standpoint of actually having, trying to use stimulants for just your work performance to help with productivity and focus. And this is actually really widespread, especially in Silicon Valley. But at the end of the day, it doesn't really matter, right? Because stress is just in our heads. So we tell ourselves, if I were tough enough, I wouldn't get so stressed. So just toughen up, right? Or, pushing through is a sign of strength. Or we tell ourselves, stress is just a sensation. So really the best approach is just to block it out. Just like I block out how sleepy I am, how tired I am, how anxious I am, my boredom, my irritation, whatever, just block it out. And all of this comes from a control mentality, right? I am the boss of my body. I can and I should be able to make my mind and body do what I want them to when I want them to. And substances and willpower, these are my tools. But I'd like to convince you of, by the end of the talk today, that ignoring stress is actually not the same as not being stressed. So let's talk about chronic stress, okay? So we said before that acute stress, so stress in the short term, can be very functional. But in the long term, when we're stressed day in and day out, there's actually quite a body of research that talks about the physiologic effects, so the effects on your body of chronic stress. And these include effects on your immune system. So things like increasing inflammation in your body, decreasing your body's ability to fight off, bugs, bacteria, viruses that come to you. Cardiovascular disease. So these are things like high blood pressure, strokes, heart attacks. Psychiatric symptoms are associated with chronic stress. So anxiety, insomnia, depression. Also endocrine system problems. So these are, for women, menstrual irregularities or even fertility issues, and also weight gain, and that affects everybody. Digestive dysfunction, so changes to the actual good bacteria in your gut that we're hearing more and more about these days, has been associated with chronic stress. So that good bacteria in your gut helps you to break down the foods that you're eating into nutrients that your body can use. And so when that the microflora, those good bacteria in your gut, change, you may not be breaking down your food as well. And as a result, you can have poor digestion, but you're actually also maybe not getting as much out of your food as you want to be or you should be. And then, of course, there is an association of chronic stress in the long term to cancer. And we'll talk about that more in a little bit. So what do we do? I mean, at the end of the day, our world is high pressure, and most of us are not going to leave our jobs, right? So we have a couple of choices. We can continue to do what most of us do, which is just to ignore it and hope that ignoring it is the same as not being stressed out. We can complain about our stress, which many of us do, and perhaps is more adaptive than just ignoring it, but still doesn't really reduce the stress level. Or we can actually try to manage it and reduce our stress. And so what I want to talk about today is a bigger picture concept of how do we build resilience in the face of stress. So let's talk about the basics here. Okay, so how we build resilience is by starting to break down this idea of the control mentality, right? I am the boss of my body. I should be able to do exactly what I want to do when I want to do it. Well, actually, what we do know about our bodies is that we're rhythmic beings. we have a physiologic rhythm, so things like our homeostasis, so back to our high school biology again, is really our innate ability to maintain balance in the critical systems in our body. So these are the oxygen, the body temperature, the pH that we talked about before. But we know that this is actually an active process, and it coordinates multiple systems of the body. And at the end of the day, all these body systems that regulate our homeostasis show a rhythmicity through the course of a 24-hour period of time. So what that means is all these processes in our body have peaks at certain times of the day, troughs at other times of the day, and how these are peaking and troughing are interrelating with the other systems of our body to maintain a rhythm over the course of a 24-hour period of time. So how do we support our natural rhythmicity? Because at the end of the day, to build that resilience we need to manage stress and to reduce stress in our lives, we should be supporting this natural rhythmicity. And we do this through some sort of basic lifestyle approaches that we probably have all heard of and we've seen talked about before. I hope to give you a slightly different spin on this. So the first is sleep, of course, eating, our physical activity, having regular downtime, and our social interactions and other external cues. So how do we actually live in rhythm? Well, I want to support this idea. So remember, I talked about before psychiatry drawing me because it's not just about the facts. We covered facts over the last couple of slides, but it's also about appreciating the interconnectedness of our subjective experience in all of this. So how we live in rhythm is in part by really developing that subjective, that introspective, that internal compass that we all have inside of ourselves. So these are things like sensations. So, just simple things like I feel hot, cold, hungry, thirsty, fatigued, or irritated. Or emotions. So I feel love, I feel happiness, intrigue, anger, sadness, boredom, whatever, frustration. And also things like intuitions or gut feeling. So like that guy feels like trouble to me right now, right? So that might be not something that makes logical sense to you, but is a feeling, an intuition you have nonetheless. So what's important is to develop an awareness of this and really learn how to interpret the messages. And there's a reason that we're not very good at this, a lot of us these days, and I'm going to talk about that more in a bit. But first, let's talk about this internal rhythm. So we talked about sleep, food, physical activity, and downtime. So let's start with sleep. So first part of this is this idea of a circadian rhythm. So this is the rhythm of the body associated with sleep. So this has natural peaks and troughs over the course of a 24-hour period of time. And this is biologic. This is something each of our bodies have their own set point and their own rhythmicity over the course of a 24-hour period. So what I like to ask people when they come in and we're talking about, how to look at sleep for them, is if you were on vacation with no set obligations, when would you go to bed and when would you wake up? It's surprising, actually. A lot of people struggle with this question. But it really is a clue to your circadian rhythm. We have people we call owls, which are the ones that sort of naturally do better at night. Maybe their most creative or their most productive time is in the evening hours or even the night hours. And they do better when they sleep in longer versus a lark, someone who, really gets tired pretty early, maybe 9 o'clock, 10 o'clock, and goes to bed and wakes up naturally pretty early. And if this is something of interest to you, or you struggle with this idea of when is my natural circadian rhythm, something you might think about is taking a free online morning-ness, evening-ness questionnaire. This is research supported. It's about 14 questions, and it helps you sort of figure out, what is my natural rhythm? And you can Google that online and find some good PDFs of that. And I want to point out that most of our society is actually built around the schedule of larks. That's people who can go to bed, 9 or 10 o'clock at night and wake up at 6 or 7 o'clock in the morning. But that's not the majority of that's not 100% of the population, I should say. And what sleep cycle mismatches is when the timing of our life obligations is mismatched to the circadian rhythm in our bodies. So that would be like an owl, someone whose natural rhythm is to be sleeping late, waking up late, who has to work at 6 a.m., or a lark who has to work the graveyard shift. So I want to talk a little bit about this mismatch. I want to convince you that this is actually really important for you. So it's been studied in both performance and development and progression of cancer and obesity. We know that women working night shifts are actually at a higher risk for breast cancer. This has been shown multiple times. We know that shift work that disrupts your circadian rhythm is actually a probable human carcinogen, meaning that it increases the risk for the development of cancer. And we also see that there's measurable loss of brain volume in certain parts of your brain, impaired performance in certain tasks, and poorer reaction times when you're just sleeping off your sleep cycle. So I'm not even talking about getting less sleep than you should. I'm just talking about sleeping at times of the day that your body doesn't naturally want to be sleeping. On the other hand, let's talk about sleep deprivation, which is actually just sleeping less than is optimal for your body. So studies are showing that most adults require at least 7 hours of sleep per night. And I know lots of people, especially in our high pressure environments, like to say, oh, I'm fine on 5 hours of sleep. But actually, even people who think that they're fine on less show decreased function on objective tasks of their performance when they sleep less than 7 hours. Many of our body's homeostatic systems are affected by sleep deprivation, and it is associated with increased emotional reactivity and impairments in your cognition. And again, going back to what we talked about before, right, when we get emotionally reactive, it's hard to work properly, right? Most of us have to interact with people to do that. When our cognition goes down, our work performance goes down. And actually, sleeping less than 7 hours per night is associated with increased risk of certain medical issues. So these are things like obesity, diabetes, high blood pressure, right? These are the same things we talked about with chronic stress, stroke. Also, overactivation of that fight or flight response. So that's the sympathetic tone in your body that gets you revved up, right? You feel nervous, you feel anxious, and makes it difficult to wind down at night and go to sleep. It's associated with increased appetite. So these are things like overeating, right? I think a lot of us, when we don't sleep enough, find ourselves snacking, and over time we can get some weight gain. And of course, stress and mental distress are associated with less than 7 hours of sleep per night. And we actually can show that all-cause mortality, so dying from any reason, is increased when you sleep consistently less than 7 hours per night. So what are we going to do, right? I promised you that we would make this practical at the end of the day. So we need to talk about what can we do to change things. And first things first, change what we can change, right? Not everything is we can't live our lives exactly the way that we want to live them. So the first question I would ask myself is, am I making choices that are consistently interfering with my sleep? I hope I've convinced you that sleep is important. So can you shift your sleep cycle to be a closer match to your circadian rhythm? So this would be like, in my work here at Stanford, I see a lot of graduate students, for instance. And a lot of graduate students don't have sort of a regular set schedule during the day. It's amorphous. They can sort of decide when to wake up, decide when to go to sleep. And yet still, many of them are not sleeping according to their sleep cycle. So if you have the ability to shift things around, I would consider doing the things that you can to shift your schedule to match your sleep cycle. I'd also suggest that you maintain regular sleep and wake times throughout the week, including the weekends, to reinforce your circadian rhythm. The other thing I'd say is avoid the vicious cycle, okay? That sort of I can't sleep, I'm tired, I'm waking up in the morning tired, so I'm gonna use caffeine or stimulants. Because at the end of the day, it's actually counterproductive. We know that caffeine, even early in the day, can disrupt sleep at night. So there was a study that showed that caffeine at 7 a.m. was actually associated with less efficient sleep by EEG and less total amount of sleep the following night, because some amount of caffeine and its metabolites are still in your system. Now, that's not a problem if you don't have sleep issues, right? So, drink your caffeine, enjoy yourself. But if you are having trouble with sleep and you're telling yourself, well, I drink 3 cups of coffee, but I drink them all before noon, so it shouldn't be affecting me. For many people, it can actually still affect your sleep. So something to think about is, if you can, avoid or reduce the caffeine or stimulants that you're taking, or switch to a more tolerable caffeine like that in tea. Actually, tea has a substance in it, has other substances in it besides caffeine that help moderate the effect of caffeine, sort of calming substances that make it more tolerable. The other sort of bad news here is that alcohol is a sleep disruptor. So no doubt, alcohol before you go to bed is going to help you get to sleep, right? A lot of people drink a glass, 2 glasses, whatever, before they go to bed because it helps them. But the problem with alcohol is it's actually quite short-acting. So what happens is you get that nice sort of decrease in your anxiety, the sort of sleepy, relaxed feeling when you drink it fairly quickly, but then it leaves your system fairly quickly. So when you fall asleep, you're fine, but then you get sort of a mini withdrawal effect while you're sleeping, and it makes you have less efficient sleep, more interrupted sleep the rest of the night. So again, if you're not having trouble with sleep, fine. But if you do have trouble with sleep, I take a look at your caffeine and I take a look at the alcohol and realize that if you really do need to sleep better, you may want to avoid alcohol to promote better sleep. What are you going to do if you can't change things, right? You don't have control over the schedule. You got to be at work at 7 a.m. and you're an owl. So there's a couple things that I would say. So the first one, I'm actually going to start with the second and third. So one thing you might think about is actually exposing yourself more to early morning light. Now, this is exactly the opposite of something an owl would actually want to do, right? Because when you're super tired and you weren't able to get to sleep till 2 a.m. and then you have to wake up at 6 a.m., the last thing you want to do is like throw the window shades open, right? And have that bright light coming in. But it actually can help you with this rhythm, right? The sleep cycle rhythm, because our circadian rhythm is synced to light. So if you expose yourself to bright light, and that includes maybe not wearing your sunglasses first thing in the morning, so you're actually exposed through your eyes to bright light, it can help you a little bit shift your sleep cycle. Turning off the screens. I know this is hard in the tech world when we really need to work, and a lot of the work we do is on screens, but turning off your screens at least 1 hour before bedtime and having no screens at all in the bedroom, so TV, your phone, your computer, keeping them out of the bedroom can help. And then the final thing I wanted to talk about is melatonin, over-the-counter, very safe over-the-counter supplement. It's something you can try. You certainly can talk about this with your doctor, but 3 to 5 milligrams in the hour before your preferred sleep time. So let's say, again, you're an owl, you like to go to bed your body wants to go to bed at 1 a.m., but you're trying to get yourself to go to bed at, say, 11, you may want to take some melatonin, try it at 10 o'clock, and see for about a week, if you do that consistently, can you start sleeping a little bit earlier? So maybe, midnight, 11:30, that kind of thing. I want to touch briefly on eating, because everybody's body is different. This has a big cultural factor as well, right? We all grew up eating different things, and all of that is fine. But what I want to do is give you some pointers. So first and foremost, our ability to sort of get up, go out, do things is a part of our metabolism, right? And our metabolism is a rhythm that needs regular input, right? So regular eating is going to help us with our energy throughout the day and support our metabolism. eat a variety. So these are a variety of, carbohydrates, fats, and proteins, so our macronutrients, but it's also just a variety of our micronutrients. So these are things like vegetables, fruits, whatever it is, try to eat different things every day if you can. Avoid processed foods. So eat things that are whole foods as much as possible. I'm sure you've heard this before. And then I'm going to put a plug in here for omega-3s. I think you should include foods with high, so this is fish oil, so things in fish or flaxseed where you can increase the amount of omega-3s that you're taking into your diet. I put here a bonus, which is if you have any interest or you're already sort of a basic cook at this point in time, learning how to cook can make a big difference in your life. It not only helps you with what you're eating and the healthfulness of what you're eating, but it actually can be quite a nice hobby to have. It can be meditative, it can be social. So if it's something that you're kind of curious about, there are classes that you can take to get yourself started, or of course cooking shows or whatever else. So something to think about. Physical activity. So your body and mind need physical activity, and a lot of it. And this can be hard when we're sort of chained to our desks and doing work at a computer all the time. So here's what I would say about including physical activity in your life. Think about what it is that you enjoy. Okay, no judgment here. So do you like strolls in the park? Do you like ping pong? Do you like interpretive dance? It doesn't matter, okay? The point is finding something that actually brings you some kind of satisfaction or some kind of joy and getting that in. Move around. So this is moving your bodies in ways you don't normally move them is really important. So variety again. And classes, if you have time for it, can be good for this. So dance, yoga, martial arts, or whatever. Because at the end of the day, skill-based workouts, so those that can engage your body and mind simultaneously, can be really helpful for people. Space. So this is downtime, and I put space in quotations here because I recently went to a conference on Tibetan medicine. And as you may recall, I have a background in Chinese medicine and studied that. And there's some overlaps between Chinese medicine and Tibetan medicine. And one of those overlaps is that they both hypothesize the presence of 5 different elements rather than the 4 that we often talk about. And the 5th element, though, in Tibetan medicine is actually space, which is the absence of substance. So there is air as one of the elements, and then space. And I think this is such an important concept to think about, the importance of having space in your life. So this can be something as straightforward as just making room for fun in your life, okay? And I'm talking about silly, mindless fun. This isn't like the adventure where, you're trekking up and you're, hiking 25 miles in a day. That's wonderful. Please do that if you want to do that. But I'm talking here about just the silly, mindless kind of fun. Meditation. So this is the ability to develop the ability to sort of clear space in your mind and really learn to be present in the moment. Because I think one of the most important things about stress is that it makes us constantly living in the future or constantly living in the past, right? And one way to sort of relieve stress is to learn how to just be present in this very moment. So at the Stanford Center for Integrative Medicine, we do offer a mindfulness meditation course. That's something you can think about if courses work for you. But actually, you can learn meditation in many different ways. And there are many apps for this as well. These are just a couple that some of my patients seem to find useful for them. But really, any app, any way in which you can approach meditation and have it be useful and something you do regularly can be helpful for you. So let's talk a little bit about external rhythm, okay? So this is things like social you, how you're interacting with your peers, how you're interacting with friends and family. And then I put a bonus in here because I just think there's some really cool research out there about the ability of music to affect our stress levels. You are a social being, and high levels of stress in all of our lives as human beings come from interpersonal friction. So this is a boss, a coworker, a spouse, a parent, whoever, but they can cause extreme levels of stress if there's friction there. So again, developing that internal compass is going to be really important to your social interactions. And of course, this is a really big topic. And I want to put forward the idea that if interpersonal frictions are something that cause you stress, you may want to consider something like psychotherapy, even short course psychotherapy, like stress management counseling for 2 or 3 sessions, all the way up to, 6, 8, 12, to long-term psychotherapy, because just having a forum to really develop new ways of interacting and dealing with conflict can be really helpful. So a couple of tips here. The amount of time you should spend with others really varies by the person, right? Some of us are introverts and we really need a lot of time to recharge by ourselves, and that's totally normal and fine. And some of us are extroverts and really like to spend a lot of time with other people. But the point here is that whatever your interactions are, you want to seek out meaningful connection. So here's what I mean by that. People you can be yourself with. People who can roll with your negative moods. So these are anger, sadness, stress, whatever, in addition to your positive ones, right? We all know the idea of a fair weather friend. So it's really important to be around people who can tolerate wherever you're at. People who like you and with whom you feel good about yourself. So I know this one sounds fairly obvious, but I think all of us can fall into the trap of really liking someone who we don't actually feel all that good around. So be careful. You want to make sure that they like you back, and that you actually feel good when you spend time with them. And then finally, people you don't need to be intoxicated with to enjoy. Okay. Yeah. So, here's that music piece. So I said there's some interesting research about music. And again, I want this to be practical. I want this to be something that you can pick up yourself, some different ideas, and start to put them into use today if you're so inclined. So one of these is, I think, so music. So listening to music actually has the ability to alter our emotional state. It can alter our brain waves by EEG. And it actually causes measurable alterations in neurotransmitters, stress hormones, endorphins, our blood pressure, our heart rate, our respirations, and our immune function. And this is really dependent on what type of music you're listening to, if it's pleasant, slow, fast, unpleasant. And then I want to point out that dance, if you're so inclined to dance, actually syncs your mind and your body. Music and that physical activity that is so important to you. So how do we use music in stress management? Your preference is what's important. So the types of music you like, not what others think you should like, is what you should be listening to. Also remember that music has the potential to both increase or decrease your stress, and it can actually change your emotional state. So really choose something that actually reduces your stress, not adds to it. Mm-hmm. And all of this being said, right, coming back around to what we were talking about in the beginning, is that a lot of stress management and a lot about learning to be resilient to stress is about getting to know yourself and respecting the rhythmicity that your body naturally has. The way we do this is through self-awareness, right? But most of us learn to question or shut this off entirely because it's often telling us things we really don't want to hear, right? I'm tired, I'm hungry, I don't like that person I have to work with, right? These are all bummer. Like this is not stuff that like really, makes us feel good in our lives in the moment that we feel it. And actually, a lot of us are told very early on that our negative emotions are really not something that should be shared. But I want to put a plug in here for this, because I would put forward to you that your ability to know yourself and know what you should move towards and also what you need to move away from is weakened if you don't have access to the negative spectrum of your emotions. So I'm not suggesting that you act on them, right, in the moment. So like, I feel pissed off at this person, let me yell at them. But I'm suggesting that you acknowledge, that you notice in the moment, oh, I'm feeling, I don't feel good right now. I feel angry right now. And so before you act on it and before you judge it, acknowledging that it's there. Because without it, that internal compass that helps you move towards things that are healthful for you and move away from things that are stressing you out is going to be weak. So questions you may want to ask yourself are, when is stress okay? And when is it too much? So first, are you chronically using substances to get by? That's a really good key to the fact that maybe stress is too much for you at this moment. Is your mental or physical health suffering? What is your internal compass telling you about this? And what sleep patterns, eating approaches, social activities, what are most compatible for you personally? So I gave you a lot of ideas about sort of areas, lifestyle changes that you could think about yourself, but sometimes we all need a little bit of guidance. So where can we go and what kinds of things should we look for if we want to have some guidance on this? First and foremost, you might think about psychotherapy. And again, short-term psychotherapy or even just counseling for a couple sessions, 2 or 3 sessions, versus, getting involved in kind of deeper work. All of that can be helpful to you. You really want to look for a therapist that you connect with, that you can relate to, and most importantly, that you can be honest with. And your company might even have therapists on staff, so you can look into that. And there's actually many different styles of therapy, CBT, which is cognitive behavioral or psychodynamic therapy. But at the end of the day, before you get bogged down in that, I would really emphasize that first piece, which is that you want someone you can connect with and be honest with. I want to talk a little bit about acupuncture here, since it's sort of my area of expertise. And I think acupuncture is really interesting in this idea of stress management and supporting rhythm, because it's really developed from Chinese medicine, which is a healing system. There's something floating in my face. Okay.
Don't stress out about it.
Thank you. It's a healing system, Chinese medicine, that's really about balance. So it's sort of based on these ideas of proper flow, timing, and movement. So there's a lot of small text on this slide, but I'm just going to hit the high points, which is that our research shows that acupuncture actually affects neurotransmitters and neuropeptides that are involved in stress, mood, anxiety, and the perception of pain. It can increase our natural endorphins. So those are natural opioids in our body that produce pain relief and a sense of well-being. And it can also decrease inflammation. And probably most interestingly for what we've talked about so far, it actually can also affect our melatonin secretion. So melatonin is very much involved in our circadian rhythm, our sleep rhythms that we talked about earlier. And it can improve sleep, reduce anxiety, and so on. So, some people may be unfamiliar with acupuncture, and it's understandably can sound a little bit scary, so I wanted to give you some background on it. Generally speaking, a treatment course is about weekly sessions for 6 to 8 weeks. That's usual. Some people only need 4 or 5 sessions. Some people, it's helpful to use a little bit more. It's thin, very, very thin, single-use disposable needles. So these are not those hypodermic type of needles that are you're drawing blood or getting shots from, which are much thicker and are disrupting your tissues. It's not painful, but people often have sensations, so things like heaviness, tingling, numbness, sensations that move around their body, and usually experienced as pleasant sensations. And we usually leave them in for 20 to 30 minutes while you relax. A lot of people ask, how do I know if this is working? Well, generally speaking, we usually give it a couple of sessions. Usually takes a little bit of time to figure out whether there's actually some improvements. Sometimes people will come in after the first session and say, you know, I did notice that I slept a little better that first night, and then all the nights after I was back to my normal. But then maybe after your second session, you might sleep a little better for 2 nights, and so on and so forth. So that's usually how improvement works, if you're going to improve with acupuncture. And the side effects are really quite minimal. So these are like pain on the insertion site, which we don't like to have, but can happen occasionally, bleeding, bruising at the insertion site, which goes away very quickly. And then massage. Massage is a classic. So we know massage, it's that manual manipulation of our muscles and our soft tissues. And when it's performed with at least moderate pressure, it can reduce stress, depression, anxiety, and our stress hormones, and enhance our immune function again. So treat yourself if you like massage. Mm-hmm. So let me pull this all together, okay? Stress is not just in your head. Chronic stress can cause wide-ranging effects on your health, and reducing stress is about supporting your body's natural rhythms. So this helps us become more resilient to stress. So that included the sleep, the eating, the physical activity, social interactions, and space. You want to develop your internal compass, which is a key to managing your stress. And some tips for developing that internal compass is to notice your emotions and your gut reactions before you judge them and before you act on them. Try to accept the negative because it's actually as necessary to your compass as the positive. And if you struggle to name or feel emotions or gut reactions, you might want to consider psychotherapy, even a short course of it, to help you reconnect. Meditation and fun can help you create space in your life, and music can help your mood if you choose something that you like. There is help, support, and guidance if you need it, so reach out if you feel comfortable to your family, to your friends. There's also psychiatry, psychology, and psychotherapy, and integrative medicine that we touched upon today, so acupuncture, massage, and other holistic modalities that might just help you take a look at what's going on in your life that maybe is contributing to your stress. How should you get started? So I want to give you some practical advice. I would suggest you choose 2 doable changes if you want to, and work on them in the first week you do this. And there really is no time like the present. So if you are interested, you may want to think about choosing 2 things right now. I would make them small, measurable tasks. So things like reducing your coffee from 3 cups to 2 cups every day, or practicing meditation for 10 minutes per day, something that's measurable. And I just wanted to remind you of all the things we talked about here. So it can be things like, maybe you go online and you take that morningness, eveningness questionnaire I suggested to take a look at your circadian cycle and try to match that up better. Or maybe you make more time for fun, or you listen to some music this week or something like that. I wanted to give you some resources. So Stanford Center for Integrative Medicine is where I primarily work out of. We do comprehensive evaluations, nutrition, acupuncture, brief psychotherapy, counseling, referrals, massage, and meditation. That's the number. And also Stanford Psychiatry. So we can do psychiatric evaluations, depression, anxiety, substance abuse, suicidality, and we can do psychotherapy and medication management as well. Where you can find me, you can find me at the Stanford Center for Integrative Medicine. You can also find me on Twitter, so that's @SpiritMend, and my Tumblr blog is spiritmender.tumblr.com, and it's a blog that is devoted to holistic psychiatry. So I try to take a look at different topics, whether it's stress, depression, anxiety, and so on, and also the intersection between Chinese medicine and psychiatry on that blog. So.
Thank you very much, Dr. Haddad. We'll now move on to the question and answer portion of our event. Several people have asked about that morningness, eveningness survey, and some have actually looked for it online. Can you give us a link or?
Yeah, so there's actually, I have a link on my personal website because I was anticipating it might be a problem to find it. You can go to nadiahaddadmd.com/discover, and I think it's the first link there. That's the morningness, eveningness questionnaire. It's just a PDF, a free PDF download, and it actually, I think it's about 14 questions, and you can fill that out, and it will tell you how to score it at the end of that.
NadiaHaddad.com.
NadiaHaddadMD.com.
Okay, NadiaHaddadMD.com/discover. Discover. Okay, so there it is. NadiaHaddadMD.com/discover. Good, that one's done. All right, here we go. How about this one? Really specific. Stress after losing a loved one. Ooh. How would acupuncture help?
Wow. I am sorry to hear about losing a loved one. So I think kind of the bigger answer to your question is that, grief is a process. And certainly, I think one of the first things that I recommend to people who are going through grief is thinking about getting some support. So if you have enough support, from friends and family, and you feel like you can talk to them, wonderful. If you, a lot of people need more support than that. So, like I said, again, even a shorter course of psychotherapy where you actually have a forum to really work through the grief, I think is really important. So I'll say first and foremost, I would think about those as important interventions. But acupuncture can be a supportive intervention. I think acupuncture is not going to bring back the loved one. It's not going to take the pain away. But if acupuncture could help you sleep a little bit better, if it could help you reduce some stress, reduce some anxiety while you're trying to kind of go through your life and process what you're going through, I think it can be a useful supportive intervention in that way.
Thank you. Do circadian rhythms change throughout our lifetime? So this person's saying, I used to be more of an owl, but now I feel like I've shifted to become more of a lark.
It can. So I think some of the research, sort of the traditional thought, is that after kind of our teenage years, that our circadian rhythm sort of gets more set, and we sort of stay that way until we hit maybe kind of starting on middle age, maybe our late 50s, 60s, and then you can start to get shifting in it. But I think it's certainly possible that our circadian rhythm can shift, right? Our circadian rhythm can shift a bit just when we are jet lagged, right? And we go to another part of the world, and then over time we have to reset with our with the sun and with light and all of that. So it can shift, but sort of the traditional thought is that our circadian rhythm is kind of more lasting. So I wouldn't expect it to shift from like day to day, week to week, but over time you might shift. That's what I'm trying to say.
Okay. And is there an omega-3 supplement that you recommend?
I don't have any, stock in any of these companies. What I recommend, so it depends on what you're using it for. So a lot of my background is in obviously depression, stress, psychiatry, and for that you really want to be looking at a supplement that has at least 1 gram of omega-3s in it per day. And for depression, you would want to have at least 60% of that be EPA versus the DHA component. Those are two different components of omega-3. If you're looking more at cardiovascular risk and you want something that's going to help you with that, the DHA component is more important. So it depends. So the point is it depends. I know of a couple supplements that meet that criteria. One, someone told me, is at Costco, so you could look there. There's also one at Pharmaca, which is the Pharmaca brand that I know of. Again, I don't have stock in Pharmaca, but it's just an easy place around here that you can go. And it's actually their clinical strength version of the Pharmaca brand omega-3.
Great. Okay. Is there a way to change your circadian rhythm? This person's saying, my husband is an owl, goes to bed at 3 a.m. and can't wake up until 11 a.m. He used to sleep at 10 p.m. and wake up at 7 a.m., but he started working from home and then everything changed.
Well, I guess the first question is that I would ask myself is why should we try to change the circadian rhythm? I mean, certainly I can understand how it may impact one's relationship or impact the ability to kind of get things done during the day, as we talked about before. Larks, the schedule of larks is really what our society is built on. So I think the first question I would ask is, does it need to be changed? Because it's better for our body and our stress level to kind of go with our circadian rhythm. But if you do need it to be changed over time, something that can help, that's what I was talking about before, is trying to get more exposure to early morning light. So for an owl, being exposed to light, 6 a.m., 7 a.m. in the morning can help. Melatonin can help for some people, so that's also something that could be tried.
Back to acupuncture a little bit. Does that help stop drinking?
So there's, I'm not, the substance abuse literature is not my area of absolute expertise, but I don't know of great evidence for acupuncture as a monotherapy. So acupuncture alone helping people stop drinking. I think it's used quite a bit in the substance abuse community, specifically the NADA protocol, which is like an auricular ear acupuncture protocol, and there's been sort of mixed results as to whether it's been helpful for addiction. It's certainly, given the risk-benefit ratio of it, meaning that the risks are very minimal, it's certainly something that one could try. But I would really recommend, if someone is looking at trying to quit drinking, to talk to your doctor, because there's actually a lot of things that we can do to help, whether that's kind of support you in making better decisions about how to reduce your alcohol safely, right? Because depending on how much you're drinking, it can actually be quite unsafe to pull it back too quickly. There's also medications that we can use, or sort of supportive strategies we could use. So I would probably start there. And then you could certainly think about acupuncture, again, to support your overall rhythms, your sleep, your anxiety, that kind of thing.
Sometimes it's cause and effect, because this next question's got the same sort of feature to it. Can you advise how to control and eliminate tinnitus, in other words, that buzzing in your ears that causes lack of sleep in relation to stress management?
Okay, so tinnitus can come from many...
I said it wrong. Tinnitus.
Tinnitus,
yeah.
Tinnitus,
okay.
Oh, yeah, can come from different... it can come from different reasons, right? So in the sort of ancient texts, can we treat tinnitus with acupuncture? We can. I don't know of the literature base in terms of how useful or effective acupuncture is for the treatment of tinnitus. I do know that when people get overworked and overstressed out, tinnitus can get worse. So by treating the stress and the overwork piece, could tinnitus presumably get a little bit better, and then supporting your sleep so that the tinnitus can get a little better. I think that makes sense, but I can't say for sure, acupuncture is the key to that, or so on.
I love this one because it gets right down to it. Do you have any suggestions on dealing with excessive rumination?
Yes, let's see here. Dealing with excessive ruminations. So, I think in and of themselves, whenever someone comes in and that's their kind of chief complaint when they come to see me, I really need to sit down and understand a little bit more what's going on in their lives. So the first thing that I think about is depression a component of this? Because one potential symptom of depression is struggling with excessive ruminations, thinking too much and not being able to get out of kind of dark or negative thoughts. I also like to think about whether kind of a overall anxiety disorder is happening. So is someone so anxious that they're getting caught in sort of anxious thoughts, and that's what's happening? Because approaching it by supporting the anxiety, treating the anxiety or the depression is really going to help with the ruminations. The next thing I would say is that if that is the major issue, thinking about psychotherapy is an important. So what should you do yourself at home to deal with excessive ruminations? I think cognitive behavioral therapy strategies can be helpful, and there are some cognitive behavioral therapy books, sort of self-help books that you can look at that talk about how to deal with it. So you could look at that. David Burns is out of Stanford, and he does a lot of cognitive behavioral therapy self-help books that you could look at. But I'd also, before you do that, I might think about, getting checked out, going to the doctor and seeing if, there are other things that you could have to support you in that process.
Great.
Make sure we're not missing anything.
We've gotten several questions about the fun equation, but I like this one. How does sex, as in with your spouse or partner, figure into fun and relaxation when it comes to that equation?
That's a great question. I think that, how does sex help with fun? Is that the question?
That whole idea of making the space for fun,
yes,
or
yes,
does it? I think maybe does it qualify as part of the question?
Okay, yes, it does, as long as it doesn't feel like work. So, I think that being able to be playful is so important, and being able to be vulnerable and intimate is incredibly important. And if you're able to make time and space to do that with your partner, I think absolutely that is so important to your health and well-being, and I would say that it qualifies as making space in your life.
Great. We also had questions about gardening or hobbies. Does that fit into fun, or is that another stressor?
I think it all depends on what you feel about it, right? So if gardening is a source of meditation and relaxation, and you can go out there and be really present with what you're doing, and it gives you a sense of satisfaction, then absolutely it's fun and creates space for you. I think if gardening is something that feels like a chore, and oh my gosh, my flowers are gonna die if I don't go out there, I need to get out there right now, I think, then no, it's not going to be the fun space for you.
Yeah, okay. And here's one, a lot of questions about sleep as well. Does sugar affect your sleep?
Yes, it can. So I think sugar in general, so if we're talking about kind of refined sugar, like I just ate a cupcake, what can happen with that is that it will peak your blood sugar, and then you can crash, right? And remember, we talked about the metabolism being important, and so having sort of steady energy being important. So I think just in general, for your overall rhythmicity, being careful. I mean, I'm not going to pull away all the enjoyable foods from you, but just being mindful about how much sugar you're having, and how much over the course of a day will be important. I think if you have a lot of sugar and you have it before bedtime, I mean, it might. I think it depends on the person. I don't know of a ton of the literature around like sugar specifically being a sleep disruptor.
Okay. And the blue light filter, this is for a screen that we've actually had it recommended on other webcasts we've done. They want to know, does it really help during the night? This person's been using the apps for this purpose, but isn't really sure that whether it really works.
So is this, can you say more about this? Is this the blue light filter like over your screens so that you can work later into the night? So, I'm not going to be able to give you a research-based answer to that. What I can tell you is that one of the problems with screens is, of course, the type of light coming out of them, which is presumably the blue light filter is meant to deal with. But I think the other big piece of it is not allowing yourself to shut your mind off in enough time before bed, which is the bigger problem. So the blue light filter is not gonna deal with that piece of it.
Off.
Yeah, it's sort of like trying to cheat the system a little bit. And I think, if we're talking about the rhythmicity, it really is about leaving space for you to unwind, so you can actually go to bed not all jazzed up, right, thinking about work or CNN or whatever it is, even if it's sort of kind of fun stuff that you're reading before bed.
I wish we had more time. There are so many great questions. I do want to say that I'm not the only one who's thanking you. Several of our people who have weighed in as well are saying thank you. Could you give us your closing comments?
My closing comments.
Yes, wrap it up for us.
Okay. Well, I just want to say thank you so much for having me here. I feel so honored to come here and speak to you today. I hope that I was able to offer you some practical advice about what you can do yourself to help manage your stress and become more resilient to stress. And I hope I was able to give you some resources. If, like all of us, you need a little guidance, to help you with this. So thank you so much, and that's it.
Thank you, Dr. Haddad, and thanks to our corporate partners for their contribution to the community. Corporate Partners employees have direct access to Stanford Health Navigators who are dedicated to serving your individual healthcare needs and can help you identify and connect to the appropriate healthcare resources regardless of your location or insurance plan. You can contact your personal Stanford Health Navigator at the number you see right there on your screen. And if you missed any of today's webcast or you'd like to view it again, it'll be available on demand using the same link you used today. Please join us again next month for our webinar about depression and anxiety in the workplace. And on behalf of Dr. Haddad and our team here at Stanford, thank you for joining us. I'm Mary Windishar.